So my name is Emma Haynes. I'm from the UK, from England. I'm a psychotherapist, a TA psychotherapist, and I specialise in perinatal mental illness and also developmental trauma. Mm-hmm. So my work is with both of those areas. Mm-hmm. And I have just completed my PhD.
Oh, congratulations.
Thank you. And that is researching transactional analysis as a treatment for perinatal mental illness.
Mm-hmm. And what are the results?
Good. Yes, it works.
Yeah. I hope we will have opportunity to read it in TAJ.
Yes, it will be in the TAJ. Yes.
Great. And how long have you been involved in TA?
I think about 12 or 13 years. Mm-hmm. So not as long as some people. It was not my first job. Mm-hmm. I was an accountant first, and then I changed to psychotherapy. Mm-hmm.
So
how did I change?
Yes, how did that happen?
I always wanted to be I wanted to study psychology, mm-hmm. but it was, I guess, for some people it wasn't considered a proper job. So I studied to be an accountant instead, mm-hmm. which I hated.
Mm. So then it's good that you changed.
Yes.
I guess it was a change in script as well.
Yes, absolutely. Yes. Yeah.
And you become interested particularly in relational TA, and
yes.
as you said, developmental.
Yeah, I'm a relational psychotherapist, mm-hmm. Yes.
And how did you choose this TA approach?
I think because the approach at the original college was classical, mm-hmm. and I found it didn't quite fit for me. Mm-hmm. It just didn't sit well with me. And when I was there, just towards the very end of that course, there was a lady came in who was a relational psychotherapist, and she gave us a day workshop on relational, and I just fell in love with it straight away. So I then trained at Metanoia Institute. Mm-hmm.
So you found yourself.
I did, yes. I became interested in trauma first. Mm-hmm. I worked in drug and alcohol for a big hospital near me for 3 years. And what I noticed, I was a psychotherapist. Mm-hmm. What I noticed is that with both drug and alcohol, that there was always something underneath. Mm-hmm. And I was curious about this. So this was at the beginning of when I first qualified. And I began to think, well, it's not just drug and alcohol. Why are we treating just these things? There's something underneath it. Mm-hmm. And I began to, I think, play around with this with some of the groups that I ran, because I ran groups, mm-hmm. To discover just what was underneath. Mm-hmm. And I began to uncover that pretty much everybody had trauma underneath. Mm-hmm. So that changed my way of thinking about treating drugs and alcohol, mm-hmm. because in my mind it was the trauma that needed treatment, mm-hmm. and that these were just symptoms, coping strategies. Mm-hmm. I also worked in a rape crisis for about 3 or 4 years, pretty much at the same time, and of course that's trauma as well. Mm-hmm. And I really enjoyed that work. Mm-hmm. And again, a lot of the people that came into that had been sexually abused as a small child. So I began to put a little links together. I did my clinical practice for my master's at an inpatient psychiatric unit. And that was a mother and baby unit. Mm. And I worked there for about 6 months. And that developed my interest in the mother and the baby and attachment. Mm. And in the UK, I realised that there was nobody that gave any kind of psychological therapy for this, that women were offered medication and not much else. CBT through the NHS, the National Health Service, but not much else. So I set myself up in my own practice, and I saw clients with trauma and women. in pregnancy and postnatally. And it just developed from there. I think I didn't really realise that this was developmental trauma for many people until I did my PhD. And the more I discovered and the more I researched, the more I found that there was more underneath. And also my research discovered how important the history of the woman is for being unwell through pregnancy. So her history, her past history, if she's had trauma or any kind of mental illness, she's far more likely to be unwell in pregnancy and postnatally. And I began to make more and more links together, and then I began to realise that actually there was transgenerational trauma happening as well. And so I think that's where I began to really think, I need to focus on developmental trauma. Yes.
Can you say your understanding of developmental trauma?
Okay, so for me, the developmental trauma that I tend to work with most is with people who have had either a childhood of neglect or abuse. And so for these people, they struggle with connection, really struggle with connection. So they yearn desperately for connection, but actually they also are terrified of human beings, because human beings either mean that they'll get nothing, or that they'll get pain, or something else very negative. And so my work with these people is about developing how we can actually begin to connect. And it's very slow work, and it's very deep, and it takes a long time, because it will be about rupture, repair, rupture, repair, rupture, repair, all the way through. It can be quite tough work, but I find it very, very satisfying to help this person begin to connect with another human being. So rather than maybe an animal or God or no one. Yeah. So, and my other workshop was about perinatal mental illness, and I see a lot of women who have had developmental trauma and in their past, and then when they become pregnant, they become very unwell. And so that actually is also, it's like a gestalt, it's like a circle for me, because I'm then helping to treat the mother and the baby. And my hope is with the baby is that they will not then get developmental trauma. So the two work sort of simultaneously together. They form a whole in my work, I think. So.
Yeah, I hear how you're very focused on the client.
Very focused on the client, yes. So with both, my focus is totally on the client and totally on how I can enable them, what I can do to help them. I like to work a lot with positivity. I don't really like going back into their trauma at all. I'm much more interested in helping them to find ways of coping with life, because many of them think that life is a struggle. And so my role, I think, is to help them form coping strategies for themselves which work. Maybe not alcohol, drug addiction, etc., but to help them find other ways of working and gaining connection with themselves as well as with other people. Because often they're isolated from themselves as well, so I have a sense that they're sort of cut off at this level. They don't really feel the body at all. So it's very enjoyable work. Yes, and I work with a child as well, which causes some people a problem, but I don't work with the child, I work with a child in the room, the baby in the room as well, so that's unusual, and that requires some ethical thought, how to manage, and normally on a week-by-week basis, I'm checking with the mother, you know, is this still okay? And when the child becomes more mobile, it becomes a little bit more challenging. But normally by that time, then they make a decision at some point that it's time for them to come on their own. And that's also really lovely because it means that they can let go of the baby. My focus is on the mother as well. And I'm always looking to see how the mother and the baby interact. Because if they struggle with bonding, then I can help teach how the mother needs to bond or how important that is for the mother. And I think some people don't really understand how clever babies are and how, I don't ever pick the baby up because that's not not for me to do. So the mother will pick the baby up, but I might tell her, or I might suggest that she puts the baby close so that the baby can see her, and then talk to the baby, and to then see how the baby interacts with her. Even at maybe 2 or 3 weeks old, the baby will interact. And a lot of mothers are quite shocked by just how much they interact with them. And so it's really lovely to be able to teach them that they're modelling for this child.
Is there something else you would like to mention that you find important?
Research. It's the biggest problem I think that TA has, is the lack of research, and I find it quite heartbreaking how few people are interested in doing research. I loved it. I found it really amazing to be able to offer to the world my research that this TA works, and this is how it works, and also to discover just how durable it is, in that people who often have TA therapy, well, in my research with perinatal mental illness, these women, they had it, and then 2, 3, 4 years, one lady 40 years later, she was still okay. So it really does work, and we have to start to tell people. We have to be able to show ourselves, to be saying, hello everybody, hello the world, you know, TA is really good. It's a really amazing way of treating the cause of illness, not just the symptomatic relief. And I think that's the thing. So I want people to start to research, and we have to provide evidence now.
What do you find most interesting in Ukraine while you're staying here these days?
Most interesting? Well, I'm not sure if it's interesting. It's life-affirming, is how friendly everybody has been. It's been lovely. I didn't know what to expect. In the UK, everybody, I said I was going to Ukraine, they all said, oh, it's dangerous, Ukraine. Now I can go home and say, okay, maybe a small part of it is, but actually the rest you need to see. It's not dangerous, it's lovely. It's beautiful. And the people are beautiful as well.
Thank you, Emma.
Well, thank you
so much.
Thank you for interviewing me.